So the anterior cruciate ligament, the ACL, is one of the four main ligaments in the knee joint, and it plays such an important role in providing stability during movements, like pivoting, cutting, and jumping. ACL injuries are common, especially among athletes participating in sports that involve sudden stops, changes in direction, and jumping. Now, special tests are used to assess the integrity of the ACL following a suspected injury. Now, these tests aim to identify signs of ACL instability or laxity, which can indicate damage to the ligament. I'm going to give a quick overview of two main special tests used to measure the ACL and discuss any issues with these tests. So before we look at the special tests in a bit more detail, let's talk about the role of the ACL. Now, it plays an important role in stabilizing the knee joint and controlling its movements. And here are some of the primary functions and roles of the ACL. So the first one is stability. The ACL helps maintain the stability of the knee joint by preventing excessive forward movement of the tibia in relation to the femur. It acts as a primary restraint against anterior translation of the tibia, especially during activities that involve sudden stops, changes in direction, and pivoting movements. It also controls rotational movements. So while the ACL's primary function is to limit anterior translation of the tibia, it also contributes to controlling rotational movements of the knee joint. It assists in preventing excessive internal and external rotation of the tibia relative to the femur, thus providing rotational stabilities during activities like cutting, twisting, and pivoting. So joint kinematics. The ACL helps maintain proper alignment and kinematics of the knee joint during various movements. It works in conjunction with other ligaments, muscles, and soft tissues to ensure smooth and coordinated motion while reducing stress on the joint structures. Protection of articular surfaces. Now, by stabilizing the knee joint, the ACL helps protect the articular surfaces of the femur and tibia from excess wear and tear. Now, proper ACL function reduces the risk of joint degeneration, cartilage damage, and other long-term complications associated with knee instability. So let's start off with the Lachman's test. So the procedure for this test, you have the patient in supine. You place their knee in about 20 or 30 degrees of flexion. Now this can be achieved through placing a towel under the patient's knee or by the therapist placing their own knee on the bed under the patient's. Now, according to Bates' Guide to Physical Examination, the leg should also be externally rotated slightly. Now, the therapist should place one hand behind the tibia and the other on the patient's thigh. And it's important that the therapist's thumb be on the tibia tuberosity. On pulling the tibia anteriorly, an intact ACL should prevent forward translation movement of the tibia on the femur. So we should feel a firm end feel. Now, anterior translation of the tibia associated with a soft or a mushy end feel indicates a positive test. More than about 2 millimeters of anterior translation compared to the uninvolved knee suggests a torn ACL, so a soft end feel, as does a 10 millimeter of total anterior translation. Now, the Lachman's test is considered one of the most sensitive tests for detecting ACL injuries, especially in the acute phase post-injury. Now, it's highly sensitive, but false positives may occur due to factors such as the therapist's technique and the patient's cooperation. So let's talk about the anterior draw test. So the procedure for this is the patient lies supine on a plinth with their hips flexed at 45 degrees. Their knees are flexed to 90 degrees and their feet are flat on the plinth. The therapist sits on the toes of the tested extremity to help stabilize it. And then the therapist will grab the proximal lower leg just below the tibial plateau or tibial femoral joint line and attempt to translate the lower leg anteriorly. Now, the test is considered positive if there is a lack of end feel or excessive anterior translation relative to the uninjured side. Now, the anterior draw test is valuable for detecting acute ACL injuries, although some research states it's not the most accurate test, and Lachman's test is more accurate. Now, similar to the Lachman's test, specificity may vary depending on the therapist skills and patient factors, leading to potential false positives.